Did you ever think that maybe there's more to life than being really, really, really ridiculously good looking?
Bye-bye Brazilian butt lifts. This is the hottest trend in cosmetic surgery right now.
This Spanish woman is undergoing a surgical procedure known as buccal fat removal.
Barney the dinosaur.
I love you.
Yeah, that Barney, just the latest in a long line of celebs rumoured to have had it.
They took out Barney's buccal fat. Is no one safe?
Other buckle-free A-listers reportedly include Bella Hadid, Khloe Kardashian, Anya Taylor-Joy and Lea Michele. Chrissy Teigen, the only one so far to confirm she's had the procedure.
Really seeing the results, and I like it.
Buccal fat is a mass of walnut-sized fat pads located between the cheek and the jawbone that help with chewing. Surgically removing it creates the appearance of chiselled cheeks and a thinner face. In the last 2 months, Google searches for the $7,000 surgery have surged in Australia, with hashtag buccal fat removal racking up more than 174 million views on TikTok.
That is me before. She was a little chunky.
When they took the fat out, it was literally like this much. 1 ball, 2 balls.
And while some people are totally into it,
I think I look pretty cute.
others are sounding the alarm.
These trends, they're fleeting, yet the surgical results are permanent.
When I'm old, this little baby fat is gonna keep me young.
I am never getting rid of my chipmunk-sized cheeks.
So what does the future hold for buccal fat and our buckle-free friends?
Friends like you and you.
Dr. Jack Zoumaras is a specialist plastic surgeon and he joins us now. Hey, Doc, we have been told that we need to obsess and hate so many different body parts. What's wrong with our buccal fat?
No, look, I think there's nothing wrong with buccal fat. I think as long as it doesn't bother you, there's nothing wrong with it. But some people have more buccal fat than others, and I think that's why there's this trend about buccal fat removal.
Do we need buccal fat? I mean, what does it do?
Yeah, look, buccal fat's important. Like, buccal fat is present essentially just below the cheekbone and just above the molars of the lower jaw, and just this little area right here. And it helps glide the buccinator muscle, which enables us to chew and eat and swallow. So it's very important. It basically produces a gliding layer for our muscle to do those important tasks.
Oh, hang on. So you're saying that people are removing fat that helps us chew food?
Basically, yes.
Oh, that can't be good. That can't be good at all. I am on record as saying I get out of bed every morning to eat. So anyway, just so you know, Jack, I'm not coming in to see you and get my buccal fat removed.
Liz is out. I want to know, does my buccal fat look big in this?
Your buccal fat is magnificent. Anyway, back to you, Jack. Is the surgery safe?
Look, I think the important thing is to go to someone that can assess the area properly, and it needs to be done by a qualified surgeon recognised by the Australian College of Surgeons, and it can be done as a local anaesthetic procedure or as day surgery, general anaesthesia, but there are risks like any invasive procedure, and some of those risks can be trivial, but sometimes they can be serious, such as bleeding, nerve injury, and also cosmetic asymmetry.
Which would be a big problem if what you're going for is a cosmetic effect, right?
Exactly,
yeah.
Exactly.
Look, you don't need me to tell you that trends, well, they change. I mean, this is the thing you have to get now, and then 5 years later it's like, oh my God, can you believe those people who got that thing? And then it just becomes a bit of a disaster. Is this in any way reversible?
Unfortunately, it's not reversible, and that's why it's all about going to a qualified surgeon to talk about it. Like, my specialty is facelift surgery, and we know with facial ageing, we actually lose volume in our face, we lose fat, so taking too much fat out can be detrimental. As you say, it's definitely a trend. Like, buccal fat probably 2 years ago in my practice was something like, it was a tool in my toolbox that I use when a patient comes to get a desired result, whether they wanted to sculpt their jaw or have a more heart-shaped face. And it's not something they asked about, it's something they asked about what they wanted to do for their face, and buccal fat may have been suitable. Now, because of these trends on TikTok especially, people are actually inquiring about buccal fat. So there's no doubt it's a trend, but it's not suitable for everyone. So what happens to people then if they get the buccal fat taken out? What happens to their faces as they age? Yeah, great question. Like, we know in general with facial ageing, we lose volume. So essentially they would probably become even more hollow through the buccal fat area, almost to the point where they're looking a little bit skeletal. So it can be detrimental to the ageing process and make them age more or have the signs of ageing a little bit earlier.
And one final question, Dr. Jack. I can't believe anyone hasn't asked this tonight. What are Italian nonnas going to do if everyone gets their buccal fat removed and they can't, grab, a bit of a little paw on the cheek, Yeah, exactly.
Well, look, the key is you've got to leave some fat behind. So even when I do a buccal fat procedure, we're always leaving some fat behind. So you never take the entire fat for that reason. So you can make sure you can have your spaghetti.
The nonnas of Australia, thank you. Dr. Jack, thanks so much for your time.
Pleasure. Thanks for having me.